Hello, my topic is drug-seeking behavior. Drug-seeking behavior is where a person fakes an illness in order to attain the prescription pills he or she desires. In most cases, doctors can't tell the difference between a normal sick patient and a drug-seeking patient. Doctors don't have time to try to figure out whether a patient is faking the symptoms or not. They just treat every patient like it's a real illness or disease. Most drug-seeking patients are attempting to obtain painkillers, such as Demerol and OxyContin, which are all available in tablet form. These painkillers are known to be amongst the most addicting pain medications out there. Who is affected? Most of the time, the people most affected by the drug-seeking patients are the drug-seeking patients themselves. These patients at one point in their lives weren't addicted to these painkillers, but what happens is they get administered these drugs because of an actual illness or disease. After that, they become addicted to it and will do anything to get their hands on them. Why the problem continues? The problem has been identified and has been ongoing for over 25 years now. It is very difficult to solve this problem because at the end of the day, there is always a chance that the patient is in actual pain. And the doctor can't let the patient stay like that, and he must prescribe the painkillers. It is difficult for the doctor to determine if the patient is in real pain or if he or she is faking it. For this reason, the problem is still ongoing. Another reason for this problem is the lack of research done on this topic. You will find very little articles in regards to drug-seeking behavior, and you will find even less media coverage. When Professor Jones showed us where to get the scholarly articles from, I found probably about 4 scholarly articles, and maybe 2 of them were good or useful. If more people know about this, then more research might be funded to figure out all the causes of drug-seeking behaviors and find the roots to their addictions. Who is benefiting from this problem? There is absolutely nobody benefiting from this problem. Sorry, Professor Jones, I know you don't like this answer, but let me explain. Even the patients that are faking the pain, if they get their painkillers, it might seem like they won and they got what they wanted, but in reality, they are living a terrible life. They need psychiatric help. They need permanent help. Their addiction is so bad that if that one day they don't have their pills and they have no way of obtaining them, then they will explode and they will rage. There were reports where a person said that his family member raged and destroyed everything in the house. He was throwing lamps across the room because he couldn't get the pills. He was breaking mirrors because he was addicted to them and he didn't have them right then and there. So even if they get the pills for that one day, what's going to happen that the day they don't get their pills? These people need a permanent solution. Solutions. One method doctors can use to identify drug-seeking patients is to look at their history. Doctors can see if the patient has any medical history of being addicted to prescription medication, or if he has a history of any drug addiction. But even if this method can prove to be controversial. What if a patient did have a bad history with drug addiction? The person can still be in pain and might actually need the prescription medication. What do you do then? Do you not give out any medication to anyone with a bad history? No, because there are people out there that do have a long, bad history with drug addiction. But on that day, they might be experiencing incredible pain. And as a doctor, you must do your best to help them in decreasing their pain. Another method doctors can use in some special cases, you can apply tests to see whether in fact the patient is in actual pain or if he or she is faking it. For example, I volunteered at a physical therapy clinic, and the physical therapist had these rods where he would put them on the patient's back, and it would cause the patient's muscles to relax or contract slowly or something. And what the physical therapist would do, he would put the rods on his back, and he would ask the patient on a scale of 1 to 10, how much pain are you in right now? And the patient would say, oh, it's like this, I'm in that much pain, it hurts a little here, hurts a little there. Then the physical therapist would look at me and He would smile and he would be like, "Look, I didn't even turn on the rods." So obviously he was faking to maybe get insurance money. In the end, there is very little research being done, and not enough people are aware of this problem. But researchers have a hard time coming up with a permanent solution, and maybe because there isn't a permanent solution. Every case is different and unique and must be approached that way.